we have seen in the composition of saliva will come again here. Okay. So main function of saliva is flushing action. By the flow of saliva, it will clean the mouth, protect the mouth from decay and all. If no saliva, no cleaning action. Food will stagnate in the mouth, attract the bacteria, leading to gum problem and decay and all can happen. Then bad breath will come, halitosis can come. So that is prevented by this cleaning action of the saliva. Salivary flow is very important. Then lubrication and permeability barrier. Already I have told, mucin will coat the tissues of the saliva and helpful in the lubrication process. And permeability barrier. This coating of mucin will prevent the entry of bacteria into the tissues, other foreign substances into the tissues, thereby protect the tissues from harmful effect of these substances. Then antimicrobial action. This you have seen. You can see from this slide. Peroxidase, lysozyme, lactoferrin, IgA, statins. These are all antimicrobial substances. They will kill the bacteria and fungus. In addition, we have got thiocyanate and ammonia and urea also. This ammonia and urea also has got buffering properties also. They can also neutralize the acids also. Then buffering action. This already we have seen. Bicarbonate present in the saliva. Urea, ammonia, all these can neutralize the acid produced by the bacteria. So acid environment leads to decay. Neutral environment will not lead to decay. So these bicarbonates naturally present in the saliva will neutralize the acid produced by the bacteria. So what happened? The pH of the saliva will be maintained between 6.8 to 7.8. Mainly the pH of the mouth depends on saliva only, salivary flow only. So neutral pH will be helpful in the prevention of infections in the mouth. Okay. Digestion. Already we have seen two enzymes, amylase, lipase, helpful in the digestion of carbohydrate and fat respectively. So digestion starts in the mouth itself. Very, very important. If you chew the food properly, the food will be present in the mouth for a longer time so that these enzymes can act and start the digestion. So it will be easy for the esophagus, stomach and all to digest very easily. If you swallow the food as such, the particles, food particles will be larger, no digestion in the mouth. So it will be difficult for the stomach to digest, leading to indigestion. So you have to chew the food very properly. Then only it will be broken down into smaller pieces and digestion starts in the mouth. So during chewing, the food will be exposed to the oral enzymes. So digestion will start in the mouth. If you swallow, this cannot happen, leading to indigestion. Mineralization. So calcium, phosphate, fluoride and all present in the saliva. So they will be helpful in the repairing of the affected enamel. Remineralization. So removal of the mineral from the tooth by decay is demineralization. Deposition leads to remineralization. So that is the important function. Taste. Food particles has to dissolve in the saliva. Saliva will take the food particles to the taste bud present in the papillae of the tongue. Then only we can appreciate the taste sensation. If there is no saliva, food particles will not dissolve. They will not be carried to the taste buds. So it's very difficult to appreciate the taste sensation. So dissolving of the food in the saliva is very, very important. It will be taken to the taste bud. We'll appreciate the taste sensation. Then tissue repair. So already we have seen the previous slide. We can see from that others that epidermal growth factor, vascular endothelial growth factor. Epidermal growth factor helpful in the formation of epithelium. Vascular endothelial growth factor helpful in the formation of blood vessels. So in the mouth, any injury occurs to the soft tissues. For example, during chewing, you may mistakenly bite the tongue, lip, cheek and all. So that time what will happen? Bleeding will occur. That tissue will be injured. So that and all will be repaired by these factors, by formation of epithelium and new blood vessels. So wound healing will be good in the mouth always because of this saliva. So these are the important functions of the saliva. So if you go through the composition, each and every component of the saliva has got one function. So each and everything component of the saliva is very, very important. Then, so we have seen the composition function. So next, the saliva can be used as a source to find out the disorders present in the patient also. You know that patient is suffering from any fever and all, they will go for a blood test. So from the blood test, they will find out what type of fever it is, malaria, typhoid. So urine test, motion test and all will be done. Likewise, Saliva can be taken, collected, and can be used to test the for the particular person. So this can be done utilizing the saliva. Saliva collection is very easy, economical, and it will not cause any pain to the patient also. Because if you give a sterile, clean container to the patient will spit the saliva very easily. That you can utilize for finding out the disorder the patient is suffering from. So in this way, saliva can be used as a medium to find out the disorder for the patient. Viral infections and then sugar present in the saliva can be estimated. Likewise, the patient will be suffering from some disorder like cancer. What type of cancer it is, we can find out from the analyzing the saliva, because some cancers will secrete some substances. That is, cancer cell will produce some substances, and sometimes our body will produce likewise in some cancer the body will produce some substances against the cancer cell. In some cancer, the cancer cell itself will produce some certain substances. They are called as a biomarkers. This also can be analyzed in the saliva. So by analyzing these biomarkers, we can find out what type of cancer it is, harmful or harmless, and what type of treatment is needed, whether the cancer is responding to treatment. That and all can be analyzed by seeing these biomarkers in the saliva. So the saliva also can be utilized as a diagnostic fluid, similar to blood, urine, and motion. Then this is one of the important conditions, xerostomia. Sometimes people have dry mouth because of lack of secretion of saliva. It can be due to some disorder of the salivary glands, or it may be due to some drugs, like drugs taken for allergy and all can cause this dry mouth. Plus, it can be due to some infections of the salivary gland. And so dry mouth can be due to so many reasons. Even diabetes can cause dry mouth. So the patient will come with a complaint of dryness in the mouth, not able to chew or speak properly, and a bad breath. Like this, they will come, and burning sensation in the mouth and all. So we have to look into the mouth and analyze what type of problem. If you find out it is xerostomia, you have to find out the cause. The xerostomia is due to what? Then you have to treat the patient. Because saliva is very important. Already we have seen it has got so many functions like lubrication, killing the microorganisms, speech, chewing the food, taste sensation, wound healing. So many things are there. So saliva is very important. So we have to treat why it is occurring. Okay. So when the patient is suffering from dry mouth, you can see that tongue will be dry, and we can see the cracks in the tongue. Then dry mouth leads to so many infections in the mouth. One such is a fungal infection. This is caused by candida, one fungus. Okay, it appears like a white patch in the palate or tongue in the buccal mucosa. So it's common in dry mouth. Usually diabetes will have a dry mouth. They are prone for this fungal infection and all. Then due to dry mouth, flushing action of saliva is not there. So what happened? Food will stagnate. Where the food will stagnate? The food usually will stagnate in uncleaned mouth and near the gums, the cervical part of the tooth. So this will attract the microorganism, leading to cervical decay or the tooth caries. So this is also common in the people suffering from the dry mouth. So like this, if there is no saliva, it can lead to so many problems like this decay, gum problem, bad breath, fungal infections, like that it can happen. So we have to treat, we have to find out whether the patient is having dry mouth, and we have to treat why the dry mouth is coming. That we have to find out the cause, we have to treat that. That's very, very important. So as such, saliva is very important. I think this presentation will be useful to you. So maintenance of proper salivary flow in the mouth is very important. That will lead to the healthy mouth. Thank you all.